Today we have Dr. Petar Seferovic. Dr. Petar is the president of Heart Failure Association of the European Society of Cardiology. He is also the academician of Serbian Academy of Sciences and Arts, professor of cardiology, University of Belgrade Faculty of Medicine and Heart Failure Center, Belgrade University Medical Center. He is also the president of Heart Failure Society of Serbia. Dr. Petar, welcome to Egypt. Welcome to CardioEgypt 2020. It's really nice to have you here. It's our pleasure and honor. Thank you so much.
No, it's my pleasure and honor to be here. I've been in Egypt many times, and I know many of your leading cardiologists. I felt excellent always here, and then I said in my opening speech, Egypt and Serbia are friends forever, and I feel here like I'm at home.
It's our pleasure, really. It's our pleasure. Thank you so much. So you've been here to Egypt so many times, but have you attended CardioEgypt before, or this is the first time?
No, I've been in CardioEgypt during the last 10 years, 3 or 4 times. Not recent, not in the last 2-3 years, but before I was here, I was also at the different meetings at the beginning of 2000s, but I was also in CardioAlex several times.
Perfect. So you've been a regular visitor so far. Let me ask you, how much difference did you notice this year than the last year if you have attended CardioEgypt?
Thank you very much for asking me that, because you can clearly see that there is a big progress in Egyptian cardiology. I am also a very good friend of your president, Professor Magdi Abdelhamid, and we are doing things in both Heart Failure Association and the ESC together. So I can clearly see that the Egyptian cardiology is up to the level of the European cardiology. There are obviously some restraints which are due to the technological development and resources. But since I am from Serbia, we can recognize that and we can fight with that. What is extremely important is that the science and education presented at CardioEgypt and in the cardiology in Egypt in general are very good. So you are following what European Society of Cardiology is saying. You are using the guidelines, and you are trying your best to treat not only cardiology patient but also heart failure patient at the best way.
Doctor, thank you so much. Your words mean a lot to us, and actually, so as you have noticed the progress here, we appreciate this so much. Thank you. Let me ask you about your talk, the talk you just finished.
I had 2 talks which are like groundbreaking projects. One was about the iron deficiency, and iron deficiency was very nicely defined as an important comorbidity. We know today that it can be treated nicely with IV iron, intravenous iron, and the Egyptian cardiologists know that. And we share the experience and knowledge, and we have a very interesting discussions. I may say that the people are interesting extremely for the latest development in the area of heart failure and cardiology. And the second talk was even more challenging because it is dealing with hyperkalemia and the drugs which is decreasing hyperkalemia. And I had actually very critical and clinically oriented talk, and we agreed that all our activities should be patient-centered and individualized to make our patient feel better and live longer.
Okay, doctor, let me ask you, how much do you think the iron deficiency would affect a patient with cardiac disease?
This is recognized comorbidity. It was hidden problem, and as far as we know, there are around 35 to 40% of the patient with heart failure who may have iron deficiency. Why this is important? Because besides treating etiology of heart failure on the first place, we may use that as an addendum to our treatment, improving the background of the patient, improving the strength of his body, and giving him opportunity to react better on the standard or device heart failure treatment.
Thank you, doctor. Let me ask you one last question. If you would please suggest a topic to be discussed or highlighted more in next year's conference.
We are dealing, and me in particular as the president of Heart Failure Association, with so-called quality of care centers in Europe in heart failure. So what I would suggest, and Egyptian cardiologists, and I need to underline that, were extremely active in the field of different studies and different registries. So what I would suggest is to give the view on not only on the science and not only on the treatment of the patient, but also on the health care aspect, how we should treat the patient with heart failure, because it's a very complex matter, using so-called heart failure centers, because I expect from the Egyptian cardiology to be involved in that project together with 25 countries in Europe, which will be like a pilot phase of our project.
Perfect, perfect. Dr. Seferovic, thank you so much for your time. Thank you for participating with us in CardioEgypt. I hope we see you next year. Thank you so much.
The pleasure was once again mine, as James Bond used to say. I will come always when you invite me, because I really feel good here, and as I already said, I feel like I'm among relatives. You know. Thank you. Thank you.
Thank you so much. Thank you. It's our pleasure. Thank you.